Good morning, and it's wonderful to be back again. So what I'd like to do today is give you an update on what's happening at NIH regarding ME/CFS research. But first, I just wanted to remind everyone that the National Institutes of Health our mission is really to find new answers, to really understand health and disease, and to find new treatments for individuals with illnesses across the spectrum. And so NIH has 27 different institutes, offices, and centers that focus on the various areas of health and research. And I work in the National Institute of Neurological Disorders and Stroke. But across NIH, there are really two big branches. So there's the branch that I work in, which is called Extramural, which is the group that we fund research across the United States and actually across the world. So we're responsible to send money out through grant awards and contracts. The intramural research is that research that takes place actually on the NIH campus. And so we now have an intramural study on ME/CFS that's ongoing as well. And across all of the institutes, we fund research, everything from the most basic research to understanding, in our institute, understanding how neurons work in Drosophila in fruit flies or in C. elegans, to get at the very most basic questions that we can ask in neuroscience, all the way to taking those discoveries into what we call translational research, which is really taking discovery into the next step that will then help us to develop a new treatment that we can then take into clinical research and first-in-human studies, so across the whole spectrum. So I work in the Division of Neuroscience within NINDS, where again, our research that we support spans everything from the most basic to the clinical research. We have a division of translational research to fill that space in the middle, and then a division of clinical research that really oversees our clinical trials. The intramural research, as I said, they span, in most institutes, span, again, the whole spectrum from very basic to clinical research. And the study that's now ongoing on ME/CFS just did their first interim analysis because they've now seen 20 individuals with ME and 20 healthy controls. And I can't report any findings at this point, other than to say that they do have some really significant leads that I think is going to help them to both really focus in on those areas as they move forward, as well as to really provide some really important information about where there might be some really targeted treatments that we could develop for ME. So, as I've talked about before, in 2015, we revitalized a working group. So there's a group of us, from representatives from 24 of the institutes and offices and centers across NIH that work together in what we call the Trans-NIH ME/CFS working group. So we work together to talk about how we can support and stimulate research on ME. And we meet regularly to discuss strategies, opportunities, how we can really move things forward. And from this, we've established the collaborative research centers, and I'll come back to that in a minute, that were funded in 2017. We recently organized the Thinking the Future workshop, the first time this was done in the United States, and we were really inspired by attending the Young Investigator workshop here a year ago, and thought we really need to do this in the United States to help support these young investigators. And then we had a 2-day accelerating research conference on ME/CFS on the NIH campus, and I'll come back to that as well. So we're very actively also supporting and talking to individuals in Australia, here in the UK, in other countries to really in Canada, to really begin to stimulate worldwide collaborations. So right now there's applications that are being reviewed in Canada to support a center that will come and join our centers in the United States in a collaborative effort. So we're very excited about that as well. And again, what we're looking for is ways in which we can develop new initiatives to really support research going forward. So these are the centers, and I talked about these last year. So we have 3 research centers, one in at Cornell with Maureen Hansen, who's the PI who you'll hear from a little bit later today, one at Columbia University with Ian Lipkin as the PI, and one at Jackson Laboratories in Connecticut, where Durya Unetmatz is the PI. So each of these centers have their own research that's ongoing, as well as collaborative projects that they're working on across the centers. So they're just in the end of August will be just the end of their second year of funding, and we're really hopeful that, again, really exciting research results will come forward from these centers. The Data Coordinating Center is working with us as well to help support the centers, but also to really help to support the greater ME/CFS research community in the United States. And so we have some very exciting things that we're developing with them, including a database we call MAP-ME that will allow for really extensive data sharing, where investigators can submit their data and then look across that data to look at and compare data from studies in metabolomics and microbiome, in genomics, to really not be working in silos, but to really be able to bring that data together in a meaningful way so we can learn even more about ME. And this is the website for the network, mecfs.rti.org, and we will be hopefully updating that on a regular basis so you can stay tuned to what's happening across those centers. So back to our Thinking the Future 2 workshop that we had in Bethesda, Maryland at the NIH Clinical Center. So we had 60 participants, 40 early career investigators, and we were hoping for 20, so we were absolutely thrilled when we had 40 individuals come. We provided 25 travel awards, and actually what was exciting was that we paid for the travel awards for everyone who requested one, so we didn't turn anyone away. Everyone was welcome to join us. And it really provided a forum to support early career investigators, and that was our mission, is to bring them together, and as Richard did for the first time here last year, and to really help them to understand a path forward with a career in ME/CFS. Because too often I hear from the young investigators, their mentors saying, there's no funding, don't go into this disease. No one cares about ME/CFS, there's no way forward. And we want to change that, because there is a way forward, and these young investigators are the way forward. They're the future. And so we really provided, we hope we provided an opportunity for them to network with each other, with NIH program staff and representatives from the nonprofits in the United States. And we were happy that we could bring people from the UK over also, Daniel, and I can't remember, there were a couple other from the UK who came over to join us, so that what our hope is, and again from the meeting this year, is to really build a worldwide network, not a US network, not a UK network, but a worldwide network of these young early career investigators so that they can work together, support each other, and really move things forward too. So we're accelerating the research conference. We had 350 participants who were physically in the room at NIH, and we had at least 500 people at any given time who were watching the webcast. And I neglected to put the website up here, and I can give that to Richard, but all of the talks were videotaped and are archived on the NIH website, so you can go back and watch any of them that you're interested in watching. So the research really presented current research on ME/CFS and related areas. And again, this was, I think, probably the first time in the United States that this kind of scientific conference has been held. And so for us, it was really terrific to have all of these people in one place. The NIH director, Francis Collins, provided remarks at the conference on the second day and talked about the hope that research brings. And I think I work very closely with him, and he understands the need significantly. And I think that we have a strong supporter there as we move forward. And the last thing about the conference is that we also included a poster session presented by the early career investigators so that they could interact as well and talk about their work with the other investigators who were at the conference. So we currently have an advisory working group. So let me back up. So every institute at NIH has an advisory council that's made up of clinicians, researchers, and the lay public that provide advice and recommendations to the director of that institute. So we, at NINDS, our advisory council put in place a working group to really help advise the director, Dr. Walter Koroshetz, who actually chairs our Trans-NIH working group, to understand what is needed and how can NIH really move in and step up our game to support research on ME/CFS. So Andrew Breeden, who's my colleague, who's here with me at this meeting this week, is the executive secretary, and then we have individuals on the committee who are, again, representative of the stakeholders, clinicians, researchers, and individuals who have ME/CFS, as well as advocates, to really help to bring forward these recommendations and guidance to Dr. Koroshetz. So they will report out in September to our advisory council, and we fully expect that one of the recommendations will be to move into a full research planning process that will identify the key research areas and focus of research that we can tackle and really make some significant difference. And so they're addressing issues like workforce, the pipeline of early career investigators. How can we get individuals who are working in related research areas but not ME to become interested in doing research on ME? And the clinician issue is huge in the United States. There's only a few clinicians scattered throughout the United States who many of them are either retiring or getting close to retirement age. So that's an issue that we are facing. And many of them are in private practice, don't take insurance. And so some of the information that Beth presented is really reflective of that. The cost of healthcare can be really great. And if you live in Massachusetts or in Iowa and there's no physician in your city, where do you go? You fly to Utah, you fly to Florida to be seen by one of these physicians, and that's not tenable. We need to do something about that. And also, we're looking at an infrastructure within the United States for interagency collaboration. And as you may know, in the United States, the Health and Human Services Department, which oversees the CDC, NIH, FDA, and other health-related agencies, had an advisory committee called CFSAC, the CFS Advisory Committee, and they made the decision to shut down that advisory committee last fall. So we're looking for a way in which we can continue the really fruitful collaborations and discussions we've developed with the CDC, with the other agencies, as well as with the patient advocacy groups and professional organizations across the United States, so that we can really together move our research agenda forward. So in terms of total funding for ME/CFS research, currently in fiscal year 17 and 18, you see that we funded $15 million in 17 and $14 million in 2018. And we were hoping actually that these numbers would grow. About half of this money, so going from the $8 million in fiscal year 16 to fiscal year 17, that increase was primarily the funding we put toward the centers. What we're not seeing is a growth in individual research coming into NIH, and we're really working hard to turn that around. I've put out the call and had many conversations here this week with people, hoping that we can really stimulate more research grants coming in, because that's how we support research, is through the grant mechanisms. And if we can't fund grants, we don't get in the door. So we're hoping to really turn that around. So recent funding, in 2018, we funded Ron Davis and his group at Stanford. We funded Stephen Schutzer, who's looking for biomarkers using proteomics to see if he can distinguish ME/CFS from fibromyalgia. And David Goldstein, who is doing this project, he's interested in catecholamine neurons and neurodegeneration in aging, but has become very interested and is part of the intramural study now, looking at changes in catecholamines in ME/CFS and how that may be either a cause and or a consequence of developing ME, and how can we develop that into a treatment. In 2019, we funded Ben Nadelson, who's looking at primarily sleep differences using an interesting rocking bed protocol. And then Jared, we just last week approved a grant for Jared Younger in Alabama to look at imaging studies looking at neuroinflammation. What we're working on now, we didn't want to wait until we got the recommendations from this working group, so we're moving forward with program announcements with special review that will be reviewed in our standing review panel that we have specifically for ME/CFS in the United States at NIH. And so this will allow grant applications to come in from investigators and encourage investigators new to ME/CFS to submit grants, encourage people who we know are out there doing ME/CFS research to submit applications, and to really support hypothesis-driven research, but we're at the place that we're at in ME. And so part of the issue that happens at NIH is that when an investigator submits a grant, they have to have really strong preliminary data to prove that what they want to do is feasible and doable. In the situation with ME, sometimes if you're bringing a new technique into the field, you don't have that preliminary data, even though it's a fantastic idea. And so that's what these announcements will do, is sort of loosen up the criteria a little bit so we can bring in some really exciting new innovative research. And in addition, a broader initiative across NIH is to support the development of biomarkers for diseases. And so I'm also encouraging some of the ME researchers in the United States, and I've talked to several people at the conference this week also from other countries, to think about how their research might fit into this. And even though it's not specific to ME research can be funded through this initiative. And that's, I think a lot of the initiatives at NIH are not specific to this disease, but are absolutely open to investigators. And so I'll end with that and just say thank you for having me here again this year, and hopefully next year I'll have lots more of exciting results and things to show you. Obviously, we're still in the development phase of a lot of these initiatives, but here are some of the websites for the Collaborative Research Network. We now have, as Richard mentioned, a website that's in development for the young investigators, and we are really dedicated to moving forward and finding answers for those of you who have ME. So thank you very much.
Thank you, Vicky. Well, there you have an up-to-date report. The best is yet to happen, I'm sure, and we want your support. So come on, ask some questions. Have we got it right? Have we got it wrong? Or is it just too slow or too fast or what? Come on. I know the answer to that last one, actually. So don't try it. So who wants to ask questions of either of our two guests?
Thank you for all the work and the funding that you do, but I have a question for Dr. Whittemore. I see you fund the Stanford study and Ron Davis in 2018. Does that funding go forward?
Yes, so yeah, I should have mentioned that, I'm sorry. So that's a 5-year grant award, yes. So that's a 5-year grant award. So our grants typically are, the R01 type research award is typically a 5-year award. The R21s are typically 2 years.
Thank you.
Yeah.
Ron's in the audience, as you may know. You have a chance to corner him and ask him what he's up to.
Hi, Paul Watton. Another question for Vicky. Regarding the funding proposals that you're getting through, one of the really frustrating messages that we've had back over the years is that the field has been in receipt of poor quality research applications, and that's been the excuse given for not funding ME/CFS to a higher level. I'd like to really put to bed the fact that the notion that you're not receiving high quality research proposals. Can you just give us that clear message back that you are receiving high quality funding proposals and that you would once again like to reiterate the 200 million target that you mentioned?
I would love to be able to fund $200 million in research grants. So we do receive high-quality research grant applications, absolutely. Our problem is that there is a bar over which those grant applications have to score. So for example, right now at NINDS, we're funding 16% of the grant applications that come in. So if you think about that, and other institutes, actually we're one of the better institutes. So what our limitation is our overall budget. Yep. And the fact that ME/CFS in our institute obviously is competing with all other neurological disease research. So we are receiving good applications. And actually the success rate for grants on ME/CFS is a little bit better than the general success rate. Our problem is we receive very few applications. So what we're trying to do is really increase the number of grants that come in so we can get even more high-quality research funded.
I understand that Congress has done us a favor this last week and is going to play ball with us and give us some more money.
We hope, right, yeah, absolutely.
How much?
How much do you want?
I've heard that NIH is getting a significant increase, but we won't know until the final budget is done. So I don't know. I don't know the answer to that. But
okay.
we could be hopeful. I mean, the last year what happened was our president put in his budget a significant decrease for NIH, and Congress turned around and gave us a significant increase. So we can only be hopeful that the same thing happens again this year.
Okay.
Thank you. Yeah.
We should be doing the same in this country too, actually. We should double that budget because it's pretty pathetic, I think, in this country. So we're watching it all and we're committed to really pushing all the time, you know. And you've got a major part to play in helping and supporting and agitating and so on. And you do that very, very well. We're on their radar now. I think they know we're here and we're staying here. Thank you very much. Can I
make one quick comment? I just want to do a shout out to the advocacy groups in the United States because this year, they've had over the course of the last few years a day up on Capitol Hill, and this year they blew it out of the water with I think over 300 visits to congressional and Senate offices, and that's what makes a difference. When they hear that from people with the disease, I can't do that. As a government employee, I can't go up to Capitol Hill, but those advocates up there telling them what's needed is really what makes a difference. So shout out to all of you and thank you.
Yeah, these politicians are pretty chicken-hearted, you know. Have a go at them, for goodness sake.
And the advocates also helped with getting the state public health agencies focused on ME/CFS so that they were interested in adopting the module. And that's also very, very important. So. When we all work together, we're much stronger.
Absolutely.
Okay, thank you very much.